Okay, so our country is Guatemala.
So for the 1990 premature deaths in YYLs, diarrheal diseases were at 842 with a 22.3%. Lower respiratory infections were 807 at 21.4%, and preterm birth complications were at 256 with 6.8%.
And then for 2010, lower respiratory infections were 487, which was 15.1%. Interpersonal violence was 474 with 14.7%, and diarrheal diseases was 256 with 7.9%.
So for the trends between 1990 and 2010, we wanted to include the chart just because we feel like it can make more sense. So as you can see, for number one, the diarrheal diseases, it went down all the way to number 3 for 2010. Lower respiratory infections increased to number 1, while preterm birth complications went down to number 4. And then you can also see that interpersonal violence went all the way up to number 2 for 2010. And still, diarrheal diseases and lower respiratory infections were the top 3 causes of premature death in both 1990 and 2010. And diarrheal diseases actually decreased by 67% from 1990 to 2010.
And then as far as like the change between 1990 and 2010, diarrheal diseases improved by about 70%. Those preterm birth complications improved by about 24%. Lower respiratory infections went up about 40%, and the interpersonal violence also went up 154%. So the diarrheal diseases and preterm birth complications changed due to the more education and better health care. The lower respiratory infections went up due to pollution from household solid fuels, as well as different occupational risks that this country is exposed to. And then interpersonal violence went up as it went in hand with major depressive disorders and alcohol use. That was a major factor in intentional injuries.
So the 5 leading causes of YLDs were major depressive disorder, low back pain, iron deficiency anemia, anxiety disorders, and neck pain.
Okay, so as far as the National Institute of Health, they said that people with functional disability experience depression, anxiety, and the lack of accessibility to the mental health services also played a role. So that is why major depressive disorder is a major thing. Also, according to the American Psychological Association, because of Guatemala's cultural, religious, social, and political beliefs, they're impacted more by violence, a lack of employment, natural disasters, and other stressors. And this also plays a major role in anxiety, which also contributes to major depressive disorder. According to the National Institute of Health, low back pain and neck pain are caused by different variables in the workplaces due to physical demands of different jobs. So their average workday consists of about 4 or more hours of repetitive movements, heavy lifting, kneeling, squatting, and climbing multiple flights of stairs. Bonus payments and incentives were offered depending on how much work they're able to complete within those 4 hours. So the more repetitive and more strain they're putting on themselves because they're working harder to get those bonuses. And then lastly, iron deficiency anemia is a leading cause in children, adolescents, and pregnant women in Guatemala. The exact reason is uncertain. However, some researchers believe that agricultural workers and the lack of screening are what plays a large role, as well as the lack of vitamin and mineral intake in this population.
As well, we wanted to include the age ranges for all of these. And so the 15 to 19 year age range was the highest for any type of mental and behavioral disorders, while up to 1 was the lowest for that, which is kind of good. But the highest for any type of nutritional deficiencies were up to 4 years old, which makes sense, again, as what Josie just explained. So the top 3 causes of disability-adjusted life years were lower respiratory infections, interpersonal violence, and diarrheal diseases, along with ischemic heart disease, diabetes mellitus, and cirrhosis of the liver, which were included for 2010, but were not even close to being anywhere for 1990. And so as for lower respiratory infections, these were communicable as well as the diarrheal diseases, while interpersonal violence was a result from injury and alcohol use, behavioral disorders. And ischemic heart disease is, of course, non-communicable, as well as diabetes mellitus and cirrhosis. And so what increased the most from during 1990 and 2010 was diabetes and HIV/AIDS, while neonatal encephalopathy decreased the most. And so some potential reasons for these are better education, better healthcare, and then of course there's increased pollution, increased nutritional deficiencies, and mental behavior disorders, which again, there's high rates of violence and then also alcohol use. And then the risk factors associated with these, the top three were alcohol use, household air pollution, and underweight children, which were also some of the top three causes of premature death. So as for alcohol use, this was associated with intentional injuries and cirrhosis, but mainly it was associated with mental and behavioral disorders. Air pollution was associated mainly with lower respiratory infections, but it was also associated with cardiac and circulatory diseases. As for children being underweight, this was due to diarrheal diseases, lower respiratory infections, but mainly nutritional deficiencies. And these are our references.